Good afternoon, everyone. My name is Emily Stinson King, and today I'm going to be talking about postpartum depression screenings among low-income mothers receiving Medicaid in Alabama. Postpartum depression screenings have become a routine part of maternal health care for good reason, as they should be, because they help identify mothers who may need additional support during a really vulnerable time. But while depression screenings are super important, the scores don't always tell us why someone is struggling. And so today I'm going to discuss why context matters when interpreting these scores and how existing research supports a more comprehensive approach to postpartum assessment. Postpartum mental health exists on a spectrum. Many mothers experience temporary mood changes after giving birth, often called the baby blues, while others develop postpartum depression that requires clinical treatment. And because untreated depression can affect maternal health, infant development, family well-being, etc., organizations like ACOG recommend routine screening throughout the perinatal period. One of the most commonly used validated screening tools is the Edinburgh Postnatal Depression Scale, or the EPDS. It's widely used because it's brief and it's easy to administer. But it's really, really important to remember that it is not a diagnostic tool. It is just a screening tool. Its purpose is to identify mothers who may need further evaluation, which means a positive score should always, always, always be followed by additional assessment rather than serving as the final answer. An elevated EPDS score tells us that someone may be experiencing emotional distress, but like I said, it doesn't always tell us what's causing that distress. And so this is where clinical judgment and interpretation become really important because research has shown that screening scores can be influenced by more than just depression alone. Stress, anxiety, limited social support, and other life circumstances can all contribute to higher scores. So, for example, imagine two mothers who receive the exact same EPDS score. One may be experiencing postpartum depression, while the other one is overwhelmed by financial stress and caring for a newborn with little to no support while also trying to work. So, their screening scores may look identical, they may have the same number, but the interventions that would help them the most may look very different. And even John Cox, who developed the EPDS, emphasized that it should never be used by itself. Instead, the score should begin a conversation with the patient, followed by clinical assessment and then the appropriate follow-up measures. This issue is especially important in Alabama because many of our Medicaid recipients face challenges and barriers that extend well beyond mental health. Transportation barriers, financial stress, shortages of healthcare providers, and limited access to maternity services can all affect the postpartum experience. So, for many mothers, these stressors can influence how they are responding to a depression screening. And this can make postpartum follow-up really, really challenging for providers because providers often have limited time with their patients, especially in rural areas where access to care is already stretched super thin. So understanding what's contributing to an elevated screening score can make it a lot easier to decide what type of support is going to be the most beneficial for that woman. The research does not suggest abandoning postpartum depression screenings as a whole by any means. Instead, it suggests building on it. So, professional organizations recommend that positive screening results be followed by additional assessment and clinical judgment rather than relying on one screening score alone. Research also tells us that postpartum mental health is influenced by more than only depressive symptoms. Stress and social support play an important roles as well. And one practical way to gather that additional information is by using additional brief validated tools like the PHQ-2 or 9, the Perceived Stress Scale, and the Social Support Questionnaire. And because these assessments are quick to administer, they can help structure follow-up conversations and provide clinicians with useful context without adding a substantial burden to busy clinical hours time-wise. In practice, this means treating a positive screening result as the beginning of the assessment rather than the end of it. So instead of immediately assuming depression is the primary concern, providers can take a few extra minutes to understand what's contributing to a mother's distress. For some women, depression may be the primary issue, and a mental health referral is appropriate. But for others, the biggest need may be help accessing community resources, strengthening social support, or receiving continued follow-up through case management or something like that. Understanding the broader context makes it a whole lot easier to match services to each person's individualized needs and also avoid flooding an already overburdened mental health system here in Alabama. This approach fits really, really well within the role of social work because our profession has always emphasized understanding people within the context of their environment. So, looking beyond a screening score allows us to consider how relationships, financial circumstances, and access to resources are all affecting a mother's well being. And applying that same perspective to postpartum depression screenings encourages more individualized care and more informed referral decisions for providers and social workers. It also strengthens collaboration between social workers, healthcare providers, Medicaid programs, etc., by creating a more consistent approach to assessing these needs. And to wrap up, so postpartum depression screenings remain an essential part of maternal health care, but they should be viewed as the starting point rather than the final step. Research suggests that postpartum mental health is shaped by depression, stress, social support, and many, many, many other life circumstances. So, taking all of these factors into account can help clinicians and social workers better understand what these mothers are experiencing and make more informed decisions about follow-up care that will best suit that mother's needs. Um, so, ultimately, understanding the context behind a screening score allows providers to connect mothers with the support that best matches their individual needs. Thank you so much.